And if you could hook it up to the camera, I'll probably record some of it. You're just gonna do it this way?
Or you could just do it this way. This is what Sharice and I did yesterday because
you're just talking.
Yeah.
Okay. Maybe you do it here where I can talk to them and not that way. Would you be all right if I did a quick recap of that? You're recording now?
Yep.
Okay. Nobody's visiting at the moment. So, all right. So we're going to start back at the beginning for lymphatic drainage, just because we weren't recording. Thank you for your patience. So first of all, we're only going to cover basic lymphatic drainage for like a sprained ankle. And anything more advanced, you should get more training on. You can either get training from one of the lymphatic drainage systems, schools of thought such as Vodder, V-O-D-D-E-R, is one of the main folks. You can also get training in what's called complete decongestive therapy, CDT, which is basically the lymphatic drainage plus the cautions and care around preventing infections, as well as the wrapping for various areas. And then you'll be more well equipped to understand conditions like lymphedema and situations where you are actually not just having an acute situation with inflammation, but an ongoing situation with inflammation, which could be various causes and even underlying kidney or heart issues. You could have extra proteins hanging out into the extracellular fluid for a variety of reasons, including if the little spaces and the capillaries are too big, bigger things can come out. And the proteins, being those giant molecules they are, they've got the little positive and negative charges on them. And so the water gets attracted to it like a magnet, like it does to salt. And so if you have too much proteins going out, you're going to attract more water out. So if you have too much water going out into the capillary spaces, then you're going to put too much burden on the lymphatic system. So even if it's draining well, it can't keep up with that. So that's an example of when there's like a bigger issue going on with too much protein exudate. I'm putting in air quotes even though it's a legitimate anatomical term, just because it's not common. So we're going to focus on just things like sprained ankles. And are there questions before I go over that basic anatomy of the lymphatic system again? Yes?
Oh, go ahead. Sorry.
We're going to go back to that. Okay, cool. So back to the basic anatomy of the lymphatic system. And it's basically a parallel system to the circulatory system. So basically, everywhere you have capillaries, you have lymph vessels, and there's a lot of the lymphatics are close to the surface. And so let's go over the basic of how this goes again. They talk about the circulatory system as a loop because you're just always looping through, whereas they talk about the lymphatic system as a one-way system because it starts with these dead-end tubes, these lymph vessels that pick up the lymph. So imagine we're taking freshly oxygenated blood from the heart. It's picked up oxygen from the blood. It's traveling out to the body. Obviously, this is happening all over the body 24/7. And when you get out to that capillary level, now the vessels are single cell thick walls. So there's better diffusion capability for the oxygen and carbon dioxide. And it's a single file capillary. So the little RBCs, red blood cells, can go through their single file, which helps increase the diffusion, oxygen and carbon dioxide. But what happens also is the water is coming out, or the fluids, the plasma can come out at this point. What happens then is if you have this, if we pretend that this is a capillary and right next to it is a lymph vessel, most of the fluid is either going to go back in the capillary or into the lymph vessel. So about 90% of it is going to go back in the capillary, and that leaves about 10% of it that needs to get picked up by the lymph vessels. And that 10% is called obligatory load. And this is a good design because what it's, sure. It'd be probably easier for me to spell up here. So about 10% of the fluids needs to get picked up by the lymph vessels. And that's in a normal situation where you don't have too much protein leaking out. Again, if you have too much protein leaking out, you're going to have more fluids leaking out. So in a normal situation, you're constantly picking up that 10% by lymph so that it can be filtered. So we're going to take that all the way through the body to go through the lymph nodes to be filtered and to go back here at the terminus where it's going to go back into the subclavian veins after it gets picked up by the bigger and bigger lymph vessels.
So we want them to go back to the subclavian.
Yep, we want them to go back up to here. And so just like veins, they have one-way valves. So they're relying a lot on the movement of muscles is going to help sort of squeeze the lymph and help it move. And it also has its own little muscular system that was not really emphasized much before, but the little kind of units of the little lymphs that can actually help move are called lymphangions. And they can actually pump a little bit. But what gets the most credit for pumping is the movement of the muscles around them and the movement of joints and anti-gravity positions, because it wants to flow, of course, with gravity. And so we have to kind of work usually against gravity. But because they have one-way valves, as soon as they go up, they can't go back down. So we're wanting to pump them all the way up to here eventually. Question?
I had an NBLEX question about the lymph system the other day.
Oh, I know what you're talking about.
Yeah.
Yeah.
And it was just like basically, what does the lymph system do?
Yeah.
Does that question make sense? Could you sum up what the lymph system does for the body?
Yeah, so its primary function is as a filtering system, as one of the mechanisms that help filters the fluid and, you know, the plasma part of the blood.
Mm-hmm.
You could also say that it helps balance the fluid levels in so much as this whole obligatory load kind of process. But the whole reason it's even there is as a filtering mechanism.
Does it do something with fats and proteins?
Well, there are like a specialized lymphatic tissue around the digestive system, around the large intestine, the lacteals. That's sort of a specialized lymph tissue, and those lacteals can process the fats.
Okay.
Yeah. There's a couple specialized lymph tissues. I was expecting to kind of focus on the main flow and the lymph nodes, but there are also lacteals, and there's also MALT, mucosal associated lymphoid tissue, that also helps purify. So basically, as a filtering system, it's also part of the immune system. And so you're doing things like, has anybody actually changed a filter on a car or a motorcycle or anything? Yeah. So part of the lymph nodes are like a physical filter. And so part of them is, if you picture, like I'm picturing when I've changed a motorcycle filter, like a little glass container with like cotton ball stuff in there that actually literally catches the large particulate matter. So part of it is literally catching the large particulate matter and then breaking it. Yeah, largely proteins. Yeah, and it could also be like bacteria. So it's going to catch that material, and then, you know, depending on whether it's a bacteria or a virus or a part of a cell or a dead cell or whatever, then the body is going to use the correct, things to destroy that, right? Whether it needs lysosomes or, white blood cells, etc. So a lot that the lymph vessels are really just a transportation system. But then it's the lymph nodes at the joints that are those filtering stations. And so another part of this brilliant design is it's like taking some of the fluids out all of the time and basically like kind of slowing that down, right? To take it out to the filters and give it, that time to have the immune system work on those things like the bacteria. It's not the only filtering system, though, of course. The kidneys are also filtering the blood, and that's crucial that that's happening all the time as well. Question?
I was just reminded of Sharice's example. I don't know who was here, but the house party when we had people in different
Oh,
corners.
yeah. She walked us around.
Yeah, we had like bacteria in this corner, and so they hired people to come in and destroy them and stuff. So really good example.
Yeah, I love
remembering that and like, oh.
Yeah, I love that example. That examples remind me too. I'm also picturing like airport security, and you kind of like, you slow people down to check it out. So that's kind of like how it works under good operating conditions. But then there's times, like I said, where you might actually either end up with too much fluid in the extracellular spaces, which is the interstitial fluid, and that might be too much for the lymph vessels to pick up. By increasing the obligatory load, things like too much proteins seeping out, too much exudate, so then the water seeps out. So too much fluids to process. That would be one reason. You can also end up with just a problem with the lymph vessels themselves. And so this can be a case where you might have this happen surgically even. So I would say one of the most common times for this is if there's cancer in the breasts, especially when it goes to the lymph nodes, which is quite common that it metastasizes in that way. And in order to remove lymph nodes in the axillary region where there's a high concentration of lymph nodes, they might damage some of the lymph vessels, particularly when the cancer gets into the lymph nodes and they have to remove some of that. That's also going to remove some of the lymphatics. So that person then tends to have a problem from then on where they might easily swell in their arm, if it's one-sided, or their arms, if it was like, say, a double mastectomy. And so lymphatic drainage can help in those situations to help keep things moving along. And actually, it's a very easy technique, or a series of techniques. And so it's actually the kind of thing that you can teach your clients if so moved. But again, if you want to really get into, lymphatic drainage after mastectomies, lymphatic drainage for lymphedema, doctors sending clients your way, I would definitely suggest that you take a continuing ed class and get more advanced training in that. So our other scenario that's very common is our body will create inflammation to many different types of injuries. And if it's just something like a sprained ankle or a sprained wrist, that's a simple temporary situation where we can help speed the healing, speed the decreasing of the inflammation. Now, the inflammation process is actually somewhat complicated, but if I was to simplify it, I would explain it like this, that your body is always going to protect against injuries as if particles like bacteria and viruses might enter the body. So your body is going to defend a sprained ankle where all you do is twist your ankle in the same way that it would defend if you stepped on a rusty nail. So if you were to step on a rusty nail, it's a very good strategy of your body to wall off the area and attack it with its immune system so that whatever enters that wound, whether it's a stab or a gunshot or a rusty nail or a cut, obviously that's an invitation for bacteria. And so your body's going to basically wall it off and attack it. Your body's going to do the same thing for a sprained ankle, though. And while this has some benefits, like protecting your overuse, so if you sprain your ankle and you have a lot of swelling and pain, it does give you important signals like, hey, this is not a good time to be really active. However, the actual mechanism of inflammation is not really necessary other than as a protective mechanism. So it is possible to speed that along and move that inflammation along. Questions, comments, additions?
Nope.
All right. Okay, so if we're going to do lymphatic drainage for something like a sprained ankle, very simply, like first aid, what's your first aid if someone has an injury like a sprain? What do you want to do? Ice it, elevate it, rest it, and compress it. Beautiful. And so we're going to focus on the elevation aspect. And you could also do the icing aspect, but not a lot of massage therapists do. But let's say you're at a PT office or a chiropractic office, wherever you have ice available, you could certainly add ice to the picture. But basically, we're going to focus on the elevation aspect and then do lymphatic drainage. So what I set up in the lab today are called body cushions. And you don't have to use that particular system, but the system is nice for a couple of things. First of all, you could use it for large-breasted women or anybody who finds it uncomfortable to lay on the flat table. Some people even use it at the beginning of pregnancy. But the other nice thing about it is it kind of just has some different pieces that you could use to elevate limbs. And a big advantage of it is that it is covered by the type of material that you could spray and clean properly. Whereas some massage clinics, particularly old school ones, might just prop up limbs with fluffy pillows. You cannot clean those properly. You can, like bed pillows. You can, however, just like hospital pillows, either just straight up use a hospital pillow or use a bed pillow covered by a vinyl covering like a hospital bed covering. So you still have those options, but I would not recommend just a fluffy pillow from your bed that you cannot clean properly. And so in particularly the interest of COVID, we're pulling out the body cushions rather than, use some pillows. Questions, comments? All right, so you're just going to elevate the limb. And so you could do that throughout the massage, right? Because it's pretty common to have somebody come limping into your clinic and they really want a massage on whatever else they normally want their massage on, but they happen to also be on crutches or the little wheelie machine for their leg. And so it's sort of usually like a secondary thing that, yeah, I have this accident going on, but I still want my massage. So basically, the whole time that they're laying down, you can keep that injury propped up. If they also want to actual focus on that injury, you could also do some lymphatic drainage for the inflammation. And if they also want to focus on the fact that they're all jacked up now from being on crutches or a little wheelie cart or whatever, you can then also observe, their movement patterns and what muscles they are overusing, being taxed on crutches, which is quite tiring. You can also kind of look at their crutches, and some people just use whatever crutches they have at home, and they might not be fitted well. And while it's not really our scope of practice to fit people's crutches, it could jack them up even worse if they're on crutches that are not a good fit for them. So we can work those compensatory patterns, but as far as the actual lymphatic drainage, what we want to do is basically work proximal from the inflammation We never work locally on the inflammation or distally on the inflammation. With lymphatic drainage, circulatory techniques that include lymphatic drainage or Swedish, or any deep techniques. So we're not working locally or distally, we're just working proximally. That's step one. So whenever you see a test question that's related to circulatory conditions, the primary most circulatory techniques are lymphatic drainage and Swedish massage. Now, some people will argue very logically based on research that Swedish massage is not really proven to improve circulation except for locally and superficially. However, for the sake of an outdated MBLEX test, the most circulatory techniques are Swedish and lymphatic. So keeping in mind that lymphatic is actually literally the most circulatory condition, your contraindications for it are conditions where too much circulation is a problem, such as autoimmune conditions like lupus, if somebody's having an active flare in particular. And you will have patients come in an active flare of lupus. And so it's not that you can't touch them at all, it's that you don't want to increase the overtaxing their body by increasing circulation at that moment in time. So at that moment in time, you can do other techniques like compression, MFR, acupressure, Reiki, tuning forks, really all kinds of non-circulatory things. Questions? Comments? All right, so back to our actual protocol. Got a sprained ankle, let's say it's a right sprained ankle, so we're going to elevate that leg. What does that mean? We want to get it basically high enough for the blood to flow downward against gravity. We want the advantage of gravity. So it's good if you can get your foot and ankle higher than your knee and your knee higher than your hip. That's great if you could do that. If not, just get it, propped up. Obviously be careful about banging them around and all if they've got, a sprained ankle or broken leg or something. So you're only going to go proximal to the injury, and we want to drain the area more proximal before we drain the area that's more distal, because we don't want to cause what in lymphatic drainage is called the bottleneck effect. So what this looks like is that while you're always doing your strokes towards the heart, you're going to first clear the area from the knee to the hip before you clear the area from proximal to the swelling up to the knee. So that you want to get the fluid from here out of the way, always towards the heart, always towards the terminus, right above the clavicle. And then you're going to clear the area distal to that, but always towards the terminus. Questions so far?
So you need to evict some things before you move things in.
Exactly. It'd be like if you're like squeezing, if you're squeezing.
Like shopping during COVID, someone has to leave before the new people go in.
There you go.
Yeah.
It's like shopping at Trader Joe's.
Yeah. Oh, don't even bring that up.
These guys are in line. They have to wait till the other people leave.
Karen's flipping out with no mask on.
Exactly.
That has nothing to do with lymphatic drainage.
We all understand.
Maybe it has something to do with lymphatic drainage. All right, yeah, exactly. Okay, so let's see. And so then also, because there's a lot of lymph nodes in the joints, the other thing you can do is basically passive range of motion on any of the joints. And it's good to do it in the order of the joints closest to the terminus, moving outwards. So in the case of the hips right here, and then the knees, if we're talking about the ankles, you could do some, passive flexion. Active works too, or active assistant. Let's say the client's too heavy for you to move them, or you're teaching them how to do this on their own. The point is just this movement. So it doesn't actually matter if it's active or passive active or active assisted. And then same for the knee. just some flexion and extension to get things flowing. Obviously, you're careful with their injury. And if it's only a one-sided injury, you only really have to work locally. But in any bigger picture scenario, lymphatics, the piece that you will also see on your MBLEX is that you want to start by clearing the terminus, which just means you're going to do the lymphatic technique here first. And it's that idea, again, of shopping in COVID. You're getting rid of some people before you're there. So we all have 6 feet. So now for the actual basic, in addition to the range of motions of joints or the pumping, the other most common techniques in lymphatic drainage are both very, very simple. One of them is you basically stretch the skin towards the terminus, and then you let it spring back. And when you're stretching, you're also kind of going in a little bit of a half circle, and then you're letting it spring back without letting off the skin. And while I describe this, I recommend you try it on yourself. So you stretch the skin, and this is a very superficial technique. As I mentioned, there's a lot of lymphatics near the surface. And so think about literally just moving the skin. So you're moving the skin, and then you let it spring back, but you don't come off the skin. That looks perfect. And then you get a little rhythm to it. So you're going about 5 to 7 times in each place, stretching, springing back, pause, stretching, springing back, pause, stretching, springing back, pause. Now it's very superficial, so one would think it's a very easy technique. I personally find it very tiring, and it's the only technique I hate doing. All the other techniques I love, but that's just me. You might enjoy it, and there's definitely a medical massage market for getting prescriptions for it. So if it's your thing, go for it. I personally cannot stand doing it. But do you like doing it all right?
I enjoy doing.
Ooh,
lymphatic
lovely.
drainage.
That's lovely. That's lovely. What do you enjoy about it?
Mostly that it makes such a difference so fast. You can
definitely.
really see progress.
Maybe I should reframe my thinking and appreciate that.
But I also do it when I'm sitting. So that helps too. If you're standing and just doing those tiny movements, like your mid back starts to, give you some trouble. So I always sit when I do it.
Yeah.
So for me, it's just kind of the same position I'm in when I do Reiki or even craniosacral. That way I can just take my time and be more comfortable when I'm doing it.
That's lovely.
But
yeah.
I enjoy it.
That's wonderful. Definitely get comfortable, because it's surprisingly difficult doing such a light technique. So yeah, sit down, get at a good height, and just get comfortable. So the other thing is, you may be wondering, do you use your fingertips, several fingers together, your whole hand? That part just really depends on what surface you're doing that to. So you could be addressing a bigger area like the arm with gently your whole hand at a time. Whereas you could do lymphatic drainage on the face even as part of a face massage. And then you might just be doing your little finger pads. Little tiny cups also work great on the face, and that I do love. But get nice little tiny glass cups, not the big suction cups for the back. We're not causing bruising. We're using little tiny cups to help move the lymph, and I have seen that be very dramatic.
We did it in class with just one side of the face, and it was frighteningly different when suddenly one side is super puffy looking and the other side looks freshly rested.
Yeah, and if you want to demonstrate to your clients the efficacy of that, you could do one half and then let them see, and then do the other half. You could do the same thing with just fingertips, but I really enjoy the TD cups for it as well.
Do you do round cupping with the little ones, or do you just keep them in the same place?
They're little tiny cups with a little tiny squeezy ball on it, and you actually make little kind of kissing motions. You go.
So you move it, but it's different than like you running something.
Exactly. They're little tiny,
Oh.
and you repeat it. Yeah, and the important thing is that you go in the order of the lymph. So this is part where if we have time where Elizabeth is supervising y'all, if I could get some printouts to, it's in your anatomy books too, but to show you, if you're going to do bigger areas of the body, the most important thing is that you know which way the lymphatics go. And mostly it's all just towards here, but there are a couple places where you need to go, okay, right here, I know I'm going down this way, and here I'm going this way. Yeah, yeah.
Or it has to go to the closest lymph area or whatever.
Basically, it's to the closest lymph, and it's, up this direction, but there's a few places where it's like, okay, here I got to route it backwards, here I got to route it upwards. So that's sort of one of the other last important pieces, is understanding that map of which way you're rerouting it. And there's this thing that you might see on the MBLEX called anastomoses, and that's also in your anatomy textbook and your massage book, which have lymphatic sections. But basically, there's like a primary lymph flow route, and the anastomoses is basically like a reroute or a detour. So I live in West Seattle. There's no bridge right now. We all go a different way, right? So if there is a break in the primary route, then it's also good for you to know the detour route, so that you can force the lymph in an alternate route. Yeah. So that's the main technique, and you do each one about 5 to 7 times. So again, we're starting most proximally, then going distally, repeating 5 to 7 times, more distally, etc. Now, when I went to school almost 30 years ago, we emphasized a different technique, which does not get emphasized much at all anymore, but I think it's a useful one to add after that in the range of motion, and that is a very light feather stroke. Obviously, it's going towards your heart, and it's such a light feather stroke that you're just, again, really on the surface of the skin. And if you keep repeating it, you'll feel this sort of texture change that's described as silky. If you don't feel a silky change, just go for 30 seconds or so.
I think it feels waxy.
Waxy?
Yeah.
That's cool.
Yeah. Yeah, I always end with the feather touch.
Yeah.
Just because once I feel that like waxy texture, I'm like, okay, yeah, all right, that's a good sign that we're making progress.
Nice, nice. Awesome. So those are the primary ones. Just remember, clear the terminus, which is a light stroke towards the middle. You're again really just moving the skin, whether you use a finger pad or a series of finger pads just above the clavicle going medially. You're doing the same skin stretch, release, without lifting off the skin, and repeating it. Now, believe it or not, if somebody is either sort of worn down and they maybe aren't even admitting to themselves that they're maybe fighting a cold, or they're just really run down and exhausted, if you were to give them a big lymphatic drainage, they might actually feel kind of sick if they were fighting something and they didn't really admit it to themselves, and all of a sudden they're getting this big lymph burden, because you can facilitate the speed of the lymph travel quite a bit with this. So that's part of the reason why, while it can be helpful to help move along lymph in the case of inflammation or lymphedema or some blockage issue, or even puffiness in the face. Somebody wants to look good for an event and they don't want to look puffy. It can be overburdensome if you try to do too much of it. Kind of like a couch potato all of a sudden working out intensely. and their body's like, oh my God, I wasn't ready for that. Yeah. So, people may feel it. Yeah. So
that's the first thing you want to start with before any other body part.
exactly. And that is one that could come up on the emblex, that you clear the terminus first. And it's above the clavicle, and it's basically helping the lymph go back to the subclavian vein via the lymphatic ducts. The thoracic duct and the lymphatic duct are the two biggest ones at the end. So it kind of starts off like, little teeny, skinny, very, very small. And those collecting ducts kind of go into bigger and bigger tributaries that get bigger and bigger until they go to the end. Now, up in the upper body, we're going pretty much straight here, right? But in the lower body, there's actually a big, deep collecting duct. And so from up here, we're not actually having to route right up to here. It's actually going to go into a deeper collecting duct.
I'd like Cerna, am I thinking of the wrong thing? Cerna Kyla.
You help me out with that one?
That word sounds familiar, and I just don't know.
I'm gonna look it up.
We're going to Google that.
I think it is cisterna.
I believe it's related, but I forget to how to directly explain it. But people do related to that also include like basically a diaphragmatic breathing, because the other thing that helps stimulate the lymph flow is this sort of negative pressure or vacuum situation that pressure changes in the chest help do. So people will sometimes actually, I would say the last lymphatic technique of the basic ones is sort of doing like a gentle pumping motion below the diaphragm, and or just having them do some diaphragmatic breathing. You can also do some pumping here and have them do like tiny mini crunches. So that's sort of the last one, but remembering that the range of motion on the joints is there too. What's that?
Oh, I was saying that was one of the pictures in the book. They showed
The little crunches.
doing that bending.
Yeah. So that's kind of the last one for the deeper thoracic region, which has something to do with the term you're saying, and I can't remember exactly
I
the
just wrote down a
application.
word, and it came to my mind. I want to make sure I wasn't thinking of a whole different system.
Yeah.
It's the
What I'm going to have Elizabeth show you and walk around, I'll show our little camera here quickly, is
All pixelated.
super pixelated, is on this diagram, I want you to pay attention to the right lymphatic duct. When we're dumping into the terminus, the actual name of the lymph vessel here is the lymphatic duct. It's not till it then goes into the subclavian vein. So that's one of the final terminating ducts, and the other one is the thoracic duct. So take a look at those two, are where the biggest ducts of where the lymph ends, and then look at the little person whose right head and right arm is green and the rest of that person is blue. That's an interesting and weird thing that I do not know why it's this way, but the right side of the head, the right shoulder, and the right arm all drain to the right thoracic duct. And here's the weird thing, the whole rest of the body goes to the left side. So there's like this weird imbalance that I don't know why, we are developed that way.
It's your head and the right.
Exactly. And in that picture coming around, it's the little part that's blue on the person. Yeah. So that's all I really wanted to cover. As you can see, the techniques are simple. And it's mainly understanding the flow of the lymph, what direction you're moving it, and those simple techniques and order and what to do and what not to do. Do you have any questions before we move on?
So really, the only technique we're doing is just the stretching one, and then just maybe some Swedish with some Thoracic.
That's close to, yes. So that one stretching technique that's sort of circular, the light stroking, which in effleurage is called a feather stroke, and then just the pumping of the joints.
Oh yeah.
Which can be done passive, active or active assisted, as long as the pumping is occurring. And then the other one to mention is that little, to get the thoracic duct and the change in the pressure in the cavity is the little crunch with the little pressure under the diaphragm. But that is all of the strokes.
Is there a certain order?
Yes. Well, people, always clear the terminus first. And then people usually do the stretching technique.
Sorry. That's my message thing, yeah. That's my
And then the pumping, and then the feather last. Yes.
So I get the pumping one. Would stretching help at all, or is that kind of just not even used with lymphatic treatment?
I think it could help. Yeah. And I forgot to mention a very important thing is that all the little lymphs, they get temporarily squished and decommissioned with heavy pressure for at least a few minutes. So the other important timing sequence is that if you're going to do this in an area that can withstand other techniques too, like Swedish, MFR, whatever, do the lymph drainage first, or do your techniques, let that area rest 10 minutes while you do something else, and then do your lymph drainage. But if you try to do it after you've done Swedish and MFR and whatever, the little vessels are going to be squished and inoperable, and then you can't really do what you were trying to do.
So would stretching maybe not be a good thing to do before, because that kind of is a lot of compression being held, like just from their own. I don't know how to describe it, but.
Yeah, I mean, it's described as like actually physically compressing them is the problem. I would think, the kind of movement and stretching is more like range of motion, where you're going to get the good kind of pulling. The little lymph vessels themselves are sort of fascinating, and they have these like little strings on them to kind of help open or close, and so that might actually kind of help open things. Yeah, but nowadays, people emphasize the fact that all of those techniques help speed the movement of the lymph and speed the movement of the lymphangions. But what they also used to emphasize is that these light pressure techniques increase the pressure outside of the lymph, which helps drive a pressure gradient to get more lymph into the vessels. So you're both encouraging more lymph into the vessels and encouraging more flow. So
I have two things to add.
Please.
So one of the things is that if somebody has like moderate edema that you're working on, and you clear a bunch of it, they will probably have to pee really badly by the end of the massage. So I usually warn people that they may have to pee like crazy once you've cleared that. And then the other thing is that you're going to run into people who have like compression stockings or compression socks or compression like arm things, and that's for the lymph, because that compression keeps it cleared.
Thanks for bringing those up. A lot of people get prescribed those. Yeah.
I leave it up to them, but usually if they're wearing the compression garment, they don't want to take it off, because that would allow fluid to start accumulating, and then they have to like tug their compression garment back on. A lot of people do the compression garments like if they have an office job, or sometimes even like checkers at grocery stores can get a lot of like swelling in their legs over the course of the day. So I usually leave it up to them. Some people want a little break from their compression garment, and some people just want to leave it on and not have to struggle to get back into it again. So if they leave it on, I don't work over it, because it's already being thoroughly compressed. But you can work proximal. Yeah.
Yeah, if it's a true medical grade one, they're very hard to remove and they're very squeezy. But some people buy like an over-counter the one, which may be just as squeezy or it may be not. But they take time to get off. Definitely it's not something you have time to do at one of the clinics that has a quick turnover, because it'll take you extra 10, 15 minutes.
It's like trying to put on pantyhose when your legs are wet.
Or scuba, like a wetsuit, dry suit.
Yeah.
Yeah. Bathing suits when you're wet, they're not fast.
Yeah.
Oh my.
Yeah, but also they are so squeezy that, like Elizabeth was saying, it's kind of pointless to try to work over them. Because, I mean, none of those gentle techniques, you're not going to be moving skin or, yeah.
And
But
oh, go ahead.
no.
I had a friend of mine that I would do some lymphatic drainage for. He was a very, very large man, probably 500 pounds. And he had diabetes really bad. And his legs would swell so much that his, like the texture of his skin, it would be really dry, kind of flaky almost. It's a very particular texture that you get when the skin is really stretched to its limit. And so one of the ways that we could tell that we were making a lot of progress is that it would change back to like a more normal skin texture, but that took a long time. So just, don't let that alarm you if you have somebody who's had swelling for a long time, or it's been like more moderate to severe. It can be very uncomfortable on the skin. Sometimes people have trouble putting their shoes on because like the tops of their feet will just swell up, or their toes will swell up. So it can be really uncomfortable. But don't, if you encounter that, it's not like anything contagious. It's nothing you have to worry about. It's just from the skin stretching.
Thank you. But back to a simple, sprain or sports injury that you'll commonly see. You may know this from personal experience, but it's true for many of your clients as well, that their physical therapist, their doctor, whoever, has probably told them as part of their self-care that they should elevate and ice quite a lot of the day, and it's one of those things where people often don't do. So just if they get it even for the duration of the massage, can be helpful, and again, for the compensatory patterns. So that's all I got on it. Anybody else? I think what I'll do is actually stop this